to get that done.
Yeah, we'll talk more about strategy in just a minute, but why is that important? Why hasn't it been covered? Now, you understand are a cancer survivor, and why is the dental side of that so important?
Well, I think it comes down to one thing, quality of life issue. Mm-hmm. A lot of patients, when they're diagnosed, maybe in their 30s, 40s, the prime of their life, and the quality of their life is being drastically affected. So if we make these changes for them, it's just going to change their life that much better for them as they move forward. You know, we're working on looking at the numbers, and we think it can get done, especially with people like Dr. Mark Varvares helping us to get that done.
Well, I want to aspect of that, so important. How does that come into play for those who have cancer of the head and neck?
Yeah, that's a really great question, Joe, and it's really at the crux of this whole matter, and that is we're talking about patients that have cancer of the mouth, so the tongue, the gums, the floor of mouth, the tonsils, the throat. And in order to care for patients with that disease or cancers in those locations, many times patients have to have surgery to remove the tumor, reconstruction, and then oftentimes have to have radiation therapy to follow to see that the cancer doesn't come back. Mm-hmm. Radiation, in addition to the surgery, which alters the anatomy of the head and neck, radiation with or without chemotherapy really changes the way the salivary glands work. So patients, after they've received head and neck radiation, have something called xerostomia, dry mouth. Dry mouth leads to dental caries, which leads to dental disease. And many times patients after treatment for head and neck cancer need to get just simple dental extractions to be able to maintain a healthy lifestyle and good oral health. And oftentimes there's difficulty getting those covered, those extractions covered because of the insurance issues. You know, dental issues after head and neck cancer treatment are in an insurer's no man's land, because typically the medical insurance won't cover it because they'll say, well, that's a dental problem, but it's a dental problem that's a direct result of treatment for a medical problem. So that's one big category, is simple dental care. Another major area where our patients need help is in patients that have to have part of their upper jaw removed. One of the ways we rehabilitate those patients is to have a very custom-made, sophisticated denture placed that will replace half the roof of the mouth. Imagine what it's like to try to talk or eat with half of the roof of your mouth missing. With dental maxillofacial prosthetics, a obturator is what we call it. Prosthetic can be fashioned that can immediately rehabilitate the patient and back to the quality of life issues, allows them to lead a much more normal life. These obturators, out of pocket, cost $50,000. Wow. We've had patients mortgage their houses in order to get the cash to cover the cost of one of these obturators because they're just not covered by insurance.
What do the insurers say about this? You said it's a insurer's no man land, but how could have this kind of fallen through the cracks?
Sorry, it's dental, not medical. We don't cover it. Mm-hmm. It's that simple.
Yeah, that's always been the argument, especially probably about 15 years ago when I filed a grievance. I won't say the insurance company, but I had a hearing up on Beacon Hill, and I was just, told sorry, and that was it. And then I figured out, I asked myself a question, well, who regulates the insurance companies? And it came down to state reps, state senators getting a bill over to the governor's desk and have it signed to make these changes necessary for the head and neck cancer survivors.
And so